Welcome, and today we focus on strategies for keeping immigrant families healthy and safe at a time when anti-immigrant policies and rhetoric keep many from accessing healthcare and other public services many of them qualify for. Today's conference is the 13th in a weekly series we began on March 27th to track the impact of COVID-19 and which has turned into a much wider exploration of systemic inequities exposed and deepened by the pandemic. On behalf of EMS, I want to extend our thanks to Blue Shield of California Foundation for their support of this ongoing initiative. We're hosting today's conference in partnership with the National Immigration Law Center as part of its Protecting Immigrant Families campaign, which is made up of hundreds of organizations nationwide advocating for humane immigrant policies. A special thanks to today's speakers, to veteran reporters Pilar Marrero and Sunita Sarabji for coordinating our initiative, and to all the 80 to 100 reporters who regularly cover these conferences. We had RSVPs for 93 attendees today. A note to those who are regulars, our pandemic update will be provided by Dr. Danielle Turner-Lloveras of UCLA's David Geffen School of Medicine. Dr. Tung Nguyen will be rejoining our conferences on July 10th.
Everyone. So the Trump administration's proposed implementation of public charge has been the sword of Damocles that's been hanging over the head of our nation's immigrants for the past 3 years. Many have stopped accessing the very services, the very public benefits that they are entitled to, especially with regards to healthcare. So our panel today will discuss the impact of public charge on the COVID-19 pandemic with additional information for your readers on how they can access the benefits to which they are entitled. So with that, I turn it over to Dr. Daniel Turner-Lloveras to give us an update on the pandemic and some of his remarks on public charge. Dr. Turner-Lloveras.
Hi, everybody. Thank you for the invitation. And so we'll begin with an overview of COVID-19 and where we are right now. Over the past several months, we've been hearing about cases going up, cases going down, and there are many different ways of looking at the data, depending on if you want to look at the rate change or if you're looking at the total number. But I'll try to keep it simple and just look at the most common ways that some of these numbers are looked at. We'll begin with the total number of cases in the United States right now is 2.4 million cases. We have a total of 124,235 total deaths, and this is updated as of today from the CDC website. In the United States, it's 736 cases per 100,000 people. To give you an idea of what that means, tuberculosis in this country is about 4 cases per 100,000, and so 736 cases per 100,000 is fairly high. Most of these cases are coming from certain states, and a lot of that has to do with testing. So the more you test, more likely it's going to lead to more cases being discovered. Those states that don't test as much doesn't necessarily mean that they have less cases. It's just that less cases are noted because less tests are being performed. So to get an idea of that, New York City has 215,000 total cases, and at the bottom of that list would be Hawaii has 782, and then there's a large range going from between those two states. Let's see. And as far as the trend, I'm sure you've been hearing in the news that there are certain states where there has been a large increase in a small period of time in the number of cases and the number of deaths. Some of those being Florida, Texas, and a few other states. There are some states now that have implemented protection policies, and so if you arrive from those states, you're traveling from those states, there are some states that now make it mandatory to quarantine yourself, since you're seen as higher risk coming from those locations. I'm more familiar with California and the LA data, but in California, if I could show you my screen, which I cannot, you'll notice that the number of total cases, the rate at least, is continuing to climb. And so every day we're having more and more cases that are being discovered by testing. The number of beds that are being filled has sort of fluctuated since the pandemic began. As of right now, we are at a higher rate than we were, or a higher number of beds have been filled with COVID patients than it was a few weeks ago. And so there is data to show that we have more cases that require hospitalization right now than we did a few weeks ago. As far as predictions, there's it all depends on who you ask, and those predictions change depending on the algorithms that are being used and the data that's being looked at. But there is a common thought that there, may be a second wave that will be coming that will require more hospital beds that are available. And so, as we open up, that does present a challenge, since that will lead to more contact between people and make it easier for the virus to spread. So although everything is opening up, I would encourage everyone to still try to maintain all the rules that we've set up. Try to wash your hands frequently as possible, or when necessary. Try to stay at home if you're able to. And if you do have to go out, just be cognizant of all the different ways in which the virus can be spread, and then try to protect yourself and, of course, try to protect others around you.
Dr. Turner-Lloveras, were you going to give us a few comments on the impact of public charge to what we're seeing? Are you going to give us a few comments on the impact of public charge to what we're
Yes.
seeing?
Oh, yes. I wasn't sure if that was now or if that was later on in the talk.
That is now.
Okay. Yes. So, colleagues of mine and myself have writing an article called "Public Charge is a Public Health Threat," and I think I referred to it in the last talk. But it's now available online as a newswire. And in that paper, we are asking for certain things to be done in order so that the consequences of public charge can be minimized for the safety of everyone. And so some of these that, let's see, I have it right here. So we identified 5 areas where the public charge rule can directly impact public health concerns, and how our recommendations for interventions and ways of responding to sort of minimize the repercussions of public charge. So one would be to ensure access to publicly funded health insurance to everyone, not just those who are documented, since this is an infection that affects everyone. And if there are really, the chain is only strong as the weakest link. And so if we decide not to provide health insurance to a certain population, it's only natural that that will allow the virus to continue to spread in those who are not able to seek the same care as everyone else. We need to stop detainment of immigrants that are seeking health care. Now, the UCSCIS stated that they would not try to arrest any undocumented immigrants who are seeking health care if it's COVID-19 related. That still presents two problems. One, if you have a fear of being deported by an entity for years, and then suddenly they say, we will not deport you if it's for this one reason, if we ask ourselves, do we think this group would suddenly feel as if they could, without fear, pursue care in this setting? Probably not. And that's some of the data that we're getting from that we're collecting on undocumented immigrants who are seeking and not seeking care, is that the fear remains, even though there was a statement saying that they would not. The second problem is that there is the possibility of an undocumented immigrant seeking care for COVID-19 related symptoms, and then if the test is negative, how is that processed? Will ICE then consider that a non-COVID-19 care that was provided, in which case then they could attempt an arrest? For all of these reasons, the best option for making this, for allowing immigrants to truly seek care without fear, would be to just stop detaining immigrants for any reason, not just if it's COVID-19 related. And so that way it won't be put into force in such a way that may be interpreted differently by different groups. Number 3 would be eliminating the overcrowding of detention centers. So that's a well-known fact about infectious diseases. In areas where there's overcrowding, there is easy spread of the infection. The reason why, when you're asking a patient about tuberculosis risk factors, you ask about, were they in areas with overcrowding, such as shelters, such as prisons? These are all risk factors for tuberculosis. And it's not just tuberculosis, but it's any type of respiratory infectious disease, such as COVID-19, in which case we should really try to address this at the root cause, and that would be stop the overcrowding, eliminate the placement of undocumented immigrants in these detention centers. We need to dismantle the Remain in Mexico program. The thought is that these people who are seeking asylum need to be in Mexico as they wait for their trial. However, if you look at it as that those who are seeking asylum actually do meet the criteria and they belong here,